Do you think that morning heel pain is always plantar fasciitis? Well, think again. This is one of the probably most common misconceptions out there about heel pain. Plantar fasciitis can be the most common cause of heel pain. Heel pain doesn't always equal plantar fasciitis. So if you are watching this video today and you've been diagnosed with plantar fasciitis and your heel pain is not getting better, this could be the reason. Maybe you don't have plantar fasciitis at all. Maybe you have one of these issues on this list today. Maybe you have another cause of heel pain. My name is Dr. Tarr, board-certified podiatrist in private practice in Phoenix, Arizona, and I own a clinic called Direct Podiatry Arizona in Tempe, where I actually deal with people with heel pain every day. So in this video today, I'm going to go over 5 causes of heel pain that are not plantar fasciitis and what you can do about them. The first cause of morning heel pain that is not plantar fasciitis is Achilles tendonitis or Achilles tendinopathy. So with Achilles tendonitis, a lot of times people will experience pain and stiffness to the back of the heel as opposed to the bottom of the heel. With really any issue with your Achilles tendon, especially those first steps that you take in the morning, will be extremely painful. And Achilles tendinopathy, specifically Achilles tendonitis, is caused by inflammation of the Achilles tendon. Because the location of your Achilles tendon is different than the location for your plantar fascia, the pain experience is in different locations. So based on where your Achilles tendon attaches to the top of your heel bone here, as opposed to your plantar fascia that inserts on the bottom of your heel bone here, where you could be experiencing the pain the most intensely will be different. So similar with plantar fasciitis, Achilles tendinopathy or Achilles tendonitis usually will be worse after resting, after sitting down for a while, and again, taking those first few steps after not moving for a while. But typically it can get less intense as you take more steps. So second cause of morning heel pain that is not plantar fasciitis is heel pad atrophy. So what happens in heel pad atrophy? We all have a certain level of fat or cushion, especially at the bottom of your heel bone here. And this helps as shock absorption. Each step you take, that fat absorbs energy as you walk. But with your fat pad, also called in your feet, sometimes over time you can lose fat to the bottom of your feet and lose that natural protective cushion. And then before, where you were walking on a nice bed of fat here, that bed of fat thins out, and then all of a sudden you're walking more and more on your bone. And this can be as painful as it sounds. Your heel, your foot will feel achy first thing in the morning, similar to plantar fasciitis, similar to Achilles tendon issues, but usually the pain with heel pad atrophy is a lot more consistent throughout the day. The third cause of heel pain in the morning that isn't plantar fasciitis is tarsal tunnel syndrome. So you might have heard of the word carpal tunnel syndrome, where you have a pinched nerve in your wrist, and that can be extremely painful. The nerve in your wrist is going through your carpal tunnel. Carpal, just a little bit of medical anatomy terms if you're interested. Carpal stands for the bones of your wrist. Tarsal bones are the bones of your feet, specifically your hind foot and midfoot. So tarsal tunnel syndrome is essentially very similar. Instead of that nerve being caught in your wrist, you have a specific branch of a nerve that's caught in your tarsal tunnel in your foot. When that nerve is pinched or trapped inside the tarsal tunnel, that can lead to pain that radiates up towards your heel or towards your toes. And sometimes you can even experiencing burning and tingling. Tarsal tunnel, similar to plantar fasciitis, Achilles tendonitis, or Achilles tendinopathy, and your heel pain atrophy, the pain, those first steps that you take after sitting down, after being asleep, first thing in the morning, usually are a lot more intense pain-wise than taking steps further along in the day. Okay, your fourth reason for heel pain in the morning that isn't plantar fasciitis is heel bursitis. So your bursa, we have bursa all throughout our body. Usually bursa are fluid-filled sacs, just like the fat pad in your feet. Bursa act as shock absorption around joints or around parts of your bone that are more prominent or stick out more than the surrounding bone. So bursitis is an inflammation of a bursa, any bursa. In heel bursitis, you have a couple different bursas surrounding your heel, and if one of those becomes inflamed, That is your heel bursitis. The pain with heel bursitis can be different depending on which bursa is affected, similar to Achilles tendonitis or any Achilles tendon issue. So heel bursitis can be triggered by repeat pressure to those areas, by wearing shoes that aren't right for your foot type, or in runners too, bursitis also can be an issue. And the fifth reason why you're having heel pain in the morning that's not plantar fasciitis is something called Baxter's nerve entrapment. Baxter's nerve entrapment is another type of nerve entrapment, and we learned earlier in this video tarsal tunnel syndrome. Baxter's nerve entrapment, though, involves a different nerve than what's affected in tarsal tunnel syndrome, being entrapped or impinged. So the nerve that's affected in Baxter's nerve syndrome, the inferior calcaneal nerve, actually supplies part of the heel bone and some muscles as well. So with Baxter's nerve entrapment, this nerve can become entrapped deep inside of the heel area, where this nerve runs between different muscles. So people describe this pain as a very deep, aching pain. Baxter's nerve entrapment, also the pain can be sharp, burning, and tingling. With Baxter's nerve entrapment too, unlike some of the other heel problems that we learned about earlier in this video, the pain can actually become worse the more that you stand or walk throughout the day. So up to 20% of heel pain causes can actually be Baxter's nerve entrapment and not plantar fasciitis. If this is your foot here, and this is your big toe, and then your small toe, your fifth toe, the pain from Baxter's nerve entrapment more commonly is the inside of your heel bone here, just because this is where that nerve branch is. So Baxter's nerve entrapment can be caused by things like overuse, improper stretching, if you have a high arch foot or a flat foot, or very tight shoes. So again, these are 5 reasons why you're having heel pain in the morning that is not plantar fasciitis. So if your heel pain is not improving with treatments, if you've been diagnosed with plantar fasciitis, and this heel pain isn't getting better, please, please, please speak with your doctor. And if your doctor isn't willing to hear your concerns, then second opinion. So not all heel pain, as you learned today, is the same. Not all heel pain can be treated the same way. So let me know in the comments below. Have you been misdiagnosed with plantar fasciitis? Did you ever get a correct diagnosis? Was it one of these things that I talked about today on my list? If you like this video today, like and comment. If you'd like to see more videos from me, feel free to subscribe and hit that notification bell so that you'll be notified whenever I post a new video. I also have links in the description box below to my private practice. Also have links in the description box to my email newsletter. Feel free to subscribe to receive an email from me weekly. And I also do have a blog post talking about this topic as well. So take care, everyone. And until next time, wishing you good health. Bye.